Hi guys, my name is Chaya Chauhan and I own True Smile Dental Practice. I'm making a series of education videos for my patients just to give them some advice during this time when the dental practices have all been shut to help to prevent the spread of COVID-19. Today I'm going to be talking about my COVID-19 diet. So I've noticed that when I'm at home, I'm constantly eating, I'm constantly grazing, there's something in my mouth all the time, whether it be nuts or little big bits of fruit, etc. But actually grazing and snacking like that is really bad for your teeth. So imagine you've got a bunch of grapes. Grapes are, although you think it's a healthy fruit, they're high in sugar and they're high in natural acid as well. So if I have a grape and then what would happen is I eat the grape, I've got sugar and acid in my mouth and the pH of my mouth drops. That means that there's a higher chance of decay and erosion happening and wrong things happening to my teeth. So what then happens is that your body fights back, the saliva helps to neutralise the acid, it brings the pH back up, so it prevents the bacteria from working and causing decay. But then what happens is that I go to do the washing up and I have another grape, and so you start the cycle all over again. So if you have all your grapes or all your bits of snacks in one go and then you don't have anything in between, then your body has a much better chance of fighting the bacteria in your mouth and neutralising the acid and preventing tooth decay. Another tip that I've learned now after snacking so much is chewing gum. So if I chew gum while I'm doing other things, then there's something already in my mouth, so it prevents me from snacking. Drink lots of water while you're at home as well. So water is actually a really good way to even combat COVID-19. So the virus can actually sit in your mouth or your throat, and if it's there for a long time, then it can start causing effects in your body. But if you're drinking water, then you wash it away and it goes into your stomach, and then your stomach acids can kill it off. So it's a good way to try to prevent even getting COVID-19. It's really important to keep up with your nutrition, so let's have lots of fruit and vegetables. Vitamin C is a really good fruit, like oranges containing vitamin C is really good to have to help to prevent you catching the virus as well. But oranges and apples, things containing vitamin C, are naturally really high in acid. So acid is bad for your teeth, it causes acid erosion. So if you're going to have that, then drink water afterwards or have a mouthwash afterwards, and try to have all your vitamin C in one go so that you're not constantly bringing the pH of your mouth down. And that will help to prevent sort of acid erosion and things like that as well. And while you've got all this time at home, what a perfect time to brush and floss your teeth. My patients, when they come to see me, they always say, oh yeah, I brush my teeth, but I don't have time to do it for the full 2 minutes, and I don't floss my teeth because I don't have time to do it. Well, guess what? Now you have time to do it. So I'm going to show you how to brush and floss your teeth correctly, so none of my patients have any excuses, and after this isolation, everyone's going to come back with perfect teeth, hopefully. Okay, so I'm just going to move this over here. I've got my set of teeth. I hope you can see that okay. Here we go. So when you are brushing your teeth, it's good to pick an angle so that your toothbrush is at a 45-degree angle to your gums, and rotate your toothbrush in a circular fashion at this junction over here. So remember, your gums is where you get gum disease, and this is the bit that we want to clean really well. So clean all the way around. So if you have a manual toothbrush, you'll need to clean it in a circular motion like so. If you have an electric Oral-B toothbrush, because this is the toothbrush head for it, you just hold it in position and the toothbrush head does all of the rotations for you. So you hold it in a circle, you do each tooth for about 2 seconds, go all the way around and do the outside of the teeth like so, and then you go back and then you do the insides of the teeth as well. So don't forget brushing the actual inside of the teeth. Same sort of thing, circular motion, brushing all the insides of the teeth there. and then do the top surfaces of the teeth. So make sure that you get into all the little nooks and crannies and things and brush all the top surfaces of the teeth as well. Going back. So now you've brushed the outside of the teeth, the inside of the teeth, and the top surfaces of the teeth. But you haven't done in between the teeth yet. So this is where you need your floss. So I'm just going to demonstrate how to floss now. Get your floss, you go, roll it in between your fingers, and you go right in between your teeth, go in between your teeth, and flick out the bit of food, and go in between your teeth, and flick out the bit of food. So if you noticed, I went towards, made a C shape around the tooth in front there, and made a C shape around the tooth at the back there as well. There you go. Now sometimes when you floss your teeth, you might find that you've got your floss in there. It's hard to take out, basically. It's a bit difficult. Sorry, my model's got, I've been demonstrating all day, so it's got wobbly teeth now for my model. But if you do have wobbly teeth in real life, don't stop that from flossing. Stop flossing, because flossing is actually really good to help to tighten your gums around those teeth as well. So say if you've got some teeth and it's really stuck and it's hard to get in, then try not to yank the floss back out, because you can end up damaging your teeth and gums. What you can just do is let go of one side and just thread it all through. There we go. So that's just some tips and tricks at this time about brushing and flossing, and hopefully when you come back to see me, all your teeth will be great. Brilliant. Thank you very much, guys.